Coming up next, we have Miss Irene De Vries. Irene De Vries. She is a maternal and newborn advisor at the Kit Royal Tropical Institute. In her presentation today, which is quite rightly titled Beyond Medical Effectiveness, What Patients, Providers, and Health Systems Need, she will discuss the intersection between the medical and social science fields, particularly how people-centered approaches and apply system-level thinking can help ensure that innovations, particularly the new ones, are adopted, sustained, and scaled well and eventually reach those in need. So please welcome her. Thank you. Please welcome Irene.
Thank you very much, Katja. Yes, my name is Irene. I'm a medical doctor, global health physician, and a medical anthropologist working for Kit Royal Tropical Institute. Before moving on, I would like to emphasize a special thanks to Amy Koroma, who is one of our Master of Public Health students from Sierra Leone. Amy did her thesis on the Baby Checker pilot project in Sierra Leone, exploring the experiences of healthcare workers and clients in Tonkolili district. And this presentation also partly refers to her work, so hence my thanks. On the picture that you see here, you see Amy on the left next to the DMO of Tonkolili districts and also Enia Seguin from Baby Checker. Next slide, please. Yes, it has already been said. The World Health Organization recommends one ultrasound before 24 weeks of gestation for pregnant women to estimate gestational age, improve detection of fetal anomalies and multiple pregnancies, reduce induction of labor for postpartum pregnancy, and improve a woman's pregnancy experience. Evidence does show that women are willing to be screened and tested for a variety of conditions, that they appreciate the knowledge and information they can get, and that offering ultrasound services may lead to earlier ANC attendance, all if services are delivered in a caring and culturally sensitive manner. However, globally and even nationally, there are major inequalities. Various factors influencing accessibility make that in many resource-poor settings, antenatal ultrasound is only available to a privileged few, often in urban centers. These factors include, but are not limited to, distances to facilities, lack of skilled ultrasonographers, lack of scans, infrastructure and inadequate power, poverty and need to pay, health illiteracy, and cultural beliefs in traditional norms that affect access. Innovations that facilitate task shifting and bring services closer to communities, like the Baby Checker, can address some of these barriers, but remaining barriers need to be considered and addressed if we truly want to contribute to universal health coverage. That's why we collaborate with Delft Imaging to co-design implementation studies that contribute to appropriate and holistic implementation. This means it's not only about the structure that is being provided, being the device and training of providers in using the device, but also about the processes around care provision, referrals, and quality control in order to achieve the best outcomes. This is what we refer to as the quality of care approach, grounded in the theory of Donabedian. Let me provide some examples about what should be considered in the process. In the study conducted by Amy, we found that some healthcare providers were using the Baby Checker as a substitute to standard care. As one of the healthcare workers said, and you can see that in this first quote, the scan works so well that now we are super attached to it. I'm worried that we are depending on it for almost everything. What happens if it gets faulty or is not available? We are losing our skills in the process. So this demonstrates the need to continuously train healthcare providers on comprehensive ANC and use the innovation to complement and not replace existing routine maternal care interventions. It was also found that while grasping the device's basic functions is straightforward, linking the diagnosis to the appropriate action necessitates certain technical expertise in midwifery and obstetrics for meaningful result interpretation. So a lack of critical thinking raises a potential risk of healthcare workers fostering a false sense of hope among clients if proper education is not provided. Another quote from a pregnant woman, you can see here, indicates the importance of training providers in appropriate counseling. This woman said, no counseling was done before or after the scan was done. We assume the baby is fine if we don't hear anything from the nurse. If your baby is not well, the nurse will refer you. So What I'm intending to say is that training on appropriate counseling as part of maternal healthcare interventions is key and remains key in delivering appropriate and respectful care. Next slide, please. Barriers to referral for ultrasound diagnosed complications is another concern, leading to ethical questions on providing a patient with a diagnosis that she cannot be helped with. In the first Look study by Franklin et al. That was conducted between 2014 and 2016 in 5 countries to assess the impact of ANC ultrasound on pregnancy outcomes in women residing in LMIC, 29% of the women who were referred did not attend the referral due to disapproval by community members or previous bad experiences with the hospital, barriers in cost, transportation, and distance. And also, after reaching the hospital, substantial barriers were identified, including not being connected with an appropriate provider, not knowing where to go, and being told to return later. Next slide, please. Factors that enable successful referral are appropriate communication, including description of the ultrasound findings and the reason for the referral, providing a referral card, describing where to go in the hospital, and explaining the procedures at the hospital. It indicates the need for implementation of ultrasound devices to work alongside health system strengthening with the requiring enabling environments, strengthening of referral systems, and quality throughout the continuum of care. The final process example that I want to give you is the one on quality and control. Equipping close to community providers with point-of-care ultrasound devices can work empowering and have an income-generating effect. However, previous studies have also indicated how the absence of proper supervision and guidelines for practitioners may create an environment for misuse and abuse, and therewith potential harm to the patients. For example, by offering ultrasound for inappropriate indications, non-evidence care, offering too many ultrasounds and charging patients for it. Quality ultrasound services and training require political will and local governance to regulate services and assure quality. This means that appropriate guidelines should be in place on who should provide the services, the required level of training and certification, and appropriate supervision to avoid overuse, underuse, or abuse. A regulating authority where professionals and facilities providing ultrasound services are registered and quality assurance of the services monitored and controlled will improve the quality of services. This also implies the use of second opinions and continuous education for all practitioners. Next slide, please. So, in conclusion, communities, providers, and health system factors interfere with medical innovations. Implementation studies are needed to ensure these factors are studied and addressed to ensure we achieve universal health coverage and deliver holistic quality care. Thank you.
Thank you. Thank you so much, Irene. That was quite fascinating. So